Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing with a special guest how Medicare sales can really pay off for your agency. And what we're referring to there are normally agencies that may or may not consider Medicare product as part of their portfolio that they are offering the public that they're dealing with. So you want to make certain that you understand some of the possibilities of this market. And we've brought in a special guest to speak to the opportunities we have, since he directs one of those financial organizations that can really give us the insight that we need on this topic. As I mentioned, the presentation will take about an hour. It is being recorded. It will be posted on our website at premiersmi.com and on our YouTube channel, but also will be sent to everyone who RSVP'd to today's meeting by email, along with some of the material that we referenced through the course of the presentation. You'll notice that you actually see who we are today. That's a little bit of an anomaly, a difference from what we do in the past. So forgive us if my face scares you. Todd will bring you back. So that's a good way of doing it. You'll notice in the software package too that there is a section for both questions and chat. We ask that you put your questions in the question box. We find that we cover many of them through the course of the presentation, but we want to make certain that we get you the information you need to feel comfortable in this space. So we'll start with a bit of level set quickly on who Premier is. We're a national marketing organization founded in 1968. That is part of the Integrity Marketing Platform with offices across the country. We offer insurance services, products, to the public through independent insurance agents such as yourself, as does my comrade, and those are delivered at contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a complete portfolio of products that appeal to this demographic. So the basic Medicare health programs are a big piece of what we do, but we also offer a full portfolio of life insurance and annuity products, final expense pre-need, long short-term care, disability income, and ancillary products. Deferring to Todd as we get to our conversation in a bit as to how some of those really come into play through financial organizations that look at things a little bit differently with a not health first perhaps approach. So you'll see some different things come into play there. These are some of the Medicare Advantage programs that we utilize, the national carriers and many of the strong regionals, same philosophy with the standalone Part D programs, and a robust portfolio of Medicare supplements as well. In the ancillary world, in each of those categories, you got the national leaders that are there for you. But we want to make certain that you look at the entire opportunity that's placed before you and your organization based on some things that perhaps you haven't done in the past, and reveal to you the opportunities that they present, the advantages of having those programs in your portfolio, and making certain that you have everything you need in order to be viable in this space and make it profitable for you. So one of the things that we need to do is introduce our guest speaker, Mr. Todd Morrissey. Hello, Todd. Thank you for coming on with us today.
Sure.
Tell us
Thank
a
you very
little bit
much
about you and AE, if you would.
Sure. Well, first and foremost, John, it's an honor to be here. You and I probably go back, 30 years that we've known each other. And just for this special occasion, I decided to get a haircut. So it would definitely, I would try to be a little bit more prettier than you. But thank you very much for giving me the opportunity to be on here. Listen, I kind of come from both sides of the fence, if you will. I worked for, quite frankly, about 15 years in the brokerage space when it came to Medicare. And listen, I have spent a lot of time in the financial side of it now, working with arguably one of the largest financial advisory firms in the country. And let me just kind of give you a quick story. So when the founders of Advisors XL wanted to get into the Medicare space, there was a reason behind it. And they were at a conference and they did a quick survey monkey with about 450 financial advisors that were in attendance, and they basically said, how many of you now are in the Medicare space, and how many of you would want to get into it? And there was roughly around 47% of the financial advisors who were already offering Medicare to their clients as part of their firm. There was probably another 45% that were raising their hand saying, I want to begin to offer it. And so that's really how Medicare, this division, and we're about 3 years old, but we've been growing by leaps and bounds. We, since basically getting started, John, up until now, we've grown, and this is no joke, about 436%. 436% since we launched this back in 2018. And the reason being is because so many more financial advisors are looking at Medicare as an opportunity to be that holistic planner. So I've got a team of 8 individuals that are there to support the advisors and work with them, get them educated, get them trained. The one thing about the financial advisor is they do want to make the process simple. So we do everything we can to help them from the educational standpoint to getting into production from an easy, streamlined approach. So it's paying off.
Awesome. I appreciate that synopsis. It's interesting when you throw in detail about percentages of folks that are already doing it and others that are looking to become involved, because sometimes we all make that mistake of the old Odd Couple line from Tony Randall that said, assume.
Yep.
We have to be careful about assuming who wants to be involved, and then, as importantly, how they want to become involved as well, what segment of the market. Because when we look at the Medicare market overall, it's huge. We all talk about the Kaiser Family Foundation's surveys and data that they put out for us, and we can see a near exponential growth in the Medicare world when you talk about folks that are aging in. But I think what gives financial advisors perhaps a little bit more of an advantage in certain spaces is they can become aware of the fact that just because someone's 65, they may not be accessing all of their benefits. And so you almost have a subset of the Medicare market where a financial advisor has an opportunity with someone who is, well, some folks will refer to it as the working aged. They may be eligible for Medicare, they may not be accessing all of their benefits. And this is an area that in many times that particular individual really needs help with their retirement services too. Yep. So targeting an area here with Medicare, you are creating those leads for the programs that you may be more comfortable with or whatever it happens to be. So a really nice piece of understanding a huge market, daytime activity, which back in the days of my tenure with Prudential a long time ago, that was a big thing. You know, I have to run appointments on weekends and evenings all the time. How can I hit the population that I can see during the day? And Todd, when you talk to your advisors and you visit in this area, how does the amount of activity come about? Do they work basically throughout the day with certain individuals, or how can they reach a larger population that isn't retired?
Well, so here's the first thing that when at least in my experience, the financial advisor, when he gets into this, again, I mentioned that they want it to be a simple approach. And one of the things we counsel our advisors on is you have a current client book of business. Go back to that current book of business and look at those folks that are about to turn 65, because a lot of the financial advisors, what they do is seminars. Now, there's nothing wrong with seminars. They do a great job, but sometimes seminars can be a little bit costly. And if you've seen some of the financial advisors, you know, you'll see them at a Ruth Chris, or you'll see them at a Prime Steakhouse. And, you know, look, that's not where you're going to be holding a Medicare seminar. We counsel them, number one, to go back to their current book of business. Anybody who's turning 65 within 6 months, to have that conversation. We provide pre-approach letters for our financial advisors. We give them talking points just to get that conversation started. Now, have they changed basically their days or their hours of what they're working? And the answer is no. I mean, they work with those clients just like they would work with any other financial client. But what they're beginning to realize is those Medicare clients, which in the past they might have looked at and said, I'm just going to refer it. Sometimes they look at Medicare as a loss leader. That's a reoccurring revenue stream. And why would you want that client to go down the street and work with somebody else? So do they change their practice, John? No, but what, again, we really try to focus on them is to target those clients that, quite frankly, are turning 65 or are already 65 to start working with them.
That's awesome. It's a market folks in the Medicare arena target for a great deal of their activity anyway, is the T65. Small percentage of the Medicare market, but when you're growing your own, that's a heck of a difference. And I think one of the things that I neglected to put into some of this data is not only how you market T65s, we got a piece there a little bit later we'll talk about, but also the fact that Medicare Advantage programs for the most part are lifetime renewals. So you're growing revenue in that particular fashion. When you look at the standalone prescription drug programs, same way, they're more subject to change, in my opinion, year over year, or should be. Yep. So it takes a little bit of activity. But the Medicare supplements, you're seeing a couple of those that have gone lifetime and a 6 to 7 year renewal fashion as well. So you're building basically a salary too with the population that you visit. So and awesome.
One thing, John, I just wanted to point out, a lot of the financial advisors, at least in my experience, is some of them, if they're a one-man shop and they're building, they will use Medicare as that marketing funnel to start to drive clients. But a lot of our financial advisors, they have sub-advisors. And what they will do is, yes, the financial advisor will get contracted and certified in order to set up the hierarchy. But that sub-advisor, they're the ones that are working with the clients. And it gives them a great training ground, not only how to start to speak to clients in that senior market, but also help them with their Medicare. And it also helps them in a training ground to then begin to get into the wealth management, the annuities, and those kind of things as well. So that's been in our experience.
A designation of a point person in an office, basically, that handles the market. Okay, yes. Cool. We visited about the size of the market and how some of it may be smaller because not everyone is taking advantage of the Medicare benefits when they're first eligible. Let's face it, Social Security for us, edge of the cusp of the edge of whatever with the baby boomers, we got to work longer to get full Social Security. So that might be an influence. We've seen a lot of stressors put on this percentage by the pandemic for one reason or another. Some have retired early. Many of them are working past the age of 65. So you got a lot of different things that come into play there as well, and include the fact that about 15% of the Medicare population is under the age of 65, medically disabled. That gives us a subset of a market that we can pursue as well. Just because someone's medically disabled doesn't necessarily mean they won't pass underwriting for different programs as well. Right. And it's a market that, for those that aren't as familiar with it, 2/3 of the population have 3+ chronic conditions, and they have some challenges with their budget. And what that tells us as an approach to this market is we have to be aware of the different choices that are there in order to accommodate the needs of our prospects and clients. And someone with a more of a financial view can really understand and work with the fact that, hey, if we set a program up there, you can plan for the inevitable and work through some different products that will help us both. Those choices, I like this slide, and to be honest, I don't even remember where I swiped it from any longer. But when someone comes into Medicare, they've got a number of choices. They can decline Part B if they want to, the optional Part B. Thankfully, not many do. Some will then take those two parts of Medicare and self-insure for the medical portion of it and pick up a standalone Part D program to help deal with some of the drug expenditures that are part of our inevitable aging process. But then you have folks that have a couple choices for the base medical. So you can go into a standardized, modernized Medigap policy, tend to be a little higher income folks, or as they say on American Pickers, you can bundle it all into a Part C program that the Medicare commercials we were all beaten to death with here during the recent AEP was sometimes referred to not only as Medicare Advantage or Part C programs, but all-in-one programs. So when someone looks at the Medicare market, we want to make certain that they have a full portfolio of product to address the needs of the entire population, because they make some choices that are pretty even in the base medical, but you have that portion here too that says original Medicare, which might be folks that decided not to do anything, might have VA benefits, might have retirement benefits, might be dual beneficiaries, both Medicare and Medicaid. So we're seeing some changes during the pandemic as to choices that are being made. And this is one of the things, Todd, when we talked earlier, setting up this presentation, our chat here, we talked about, okay, Todd, I'm assuming these are financial advisors. They only want to deal with the high income folks, the half that have money for other products or whatever it happens to be, they're pushed toward med subs. And you educated me on the fact that, hey, just because they deal with people with money in a lot of cases, that doesn't mean they want to ignore the Medicare Advantage side of it. So what's the experience been there? What's the usage been within a financial organization or slanted that way?
Yeah, great question. So I will tell you just quick, I think it's funny. So when I started at Advisors XL building this Medicare division, a lot of our annuity VPs here referred to us as the Advisors XL Medicare Supplement Division. And I had to quite educate them to say we're not a Medicare Supplement Division, we're a Medicare Solutions Division, and that entails both Medicare Advantage and Medicare Supplement. Now, I would have told you as I was getting into this that most of the financial advisors dealing with the type of clientele would have probably been selling more Medicare Supplement. And I was wrong. I'm telling you right now, we are probably at it's maybe about a 50-50 right now, I would say, as far as Medicare Advantage and Medicare Supplement, because we have a number of financial advisors who are in, let's say, high profile Medicare Advantage areas. Let's say they're in Florida, California, some of them in the Chicago area. And look, just because somebody has money, yes, they can afford a Medicare Supplement premium, but in those areas where the networks are strong, they have their specialists who's part of the network, the hospital is, clients look to save money just like anybody else. And if they feel that the Medicare Advantage plan is a strong product for them, we've seen a lot of them that are getting Medicare Advantage plans. So I will tell you this, a number of them also, this is really interesting, John. This is something that just kind of came about after doing some analysis of our product offering and sales during the annual election period. One thing that we're starting to see a little bit more of, MSAs. So there's a number of clients who maybe have a high net worth who are comfortable with a MSA. And, that's something that in my past, we didn't see a lot of that, but we're starting to see more of the clients starting to sell more of or take on a Medicare savings account. So, and let me just say this real quick. I think that's a lot because they've been coming off of an HSA plan. And that's one of the things that, financial advisors, they look out. I mean, they're talking to a client about their IRMA charges. And again, that's something, IRMA charges. And if they're falling into a certain category, what can we do as you're approaching Medicare to try to help drop you down into a lower category? But also clients who are on a health HSA, as they're getting into Medicare, they're comfortable with that particular high deductible plan. So they're shifting into that as well. So that's what we're seeing.
That's a great point. I think as the population ages, that the Medicare population, particularly the folks that are coming into it, are much more accustomed to new delivery of healthcare options. They're comfortable with a network-based program because that's what they had at work. And to your point, the HSAs, the MSAs, all those different pieces that are options for people that they've had during their work experience, that may well be something they want to continue. Great point. So that's an option there. And one of the things that we're being asked is one of the questions that popped up, Todd, is if we have information as to when's the right time to start taking Social Security and making the right decision when aging into Medicare. We've got a couple of different presentations there in that area, Mr. Graham, that might be helpful for you. I'll get with Todd too to make certain that we coordinate some of the activity of this area, and I'll get that to you directly. So we'll have that for you. And I think that's a great topic for us Todd, when we speak to some of the future events in our discussion, you mentioned IRMA. We need to speak to that specifically
Yep.
outside of this presentation because my third cup of coffee's kicked in and I'm going to talk more than I really probably should. We don't want to go too long. But we have that. And then, of course, how you can coordinate benefits when to file for Social Security. There are carriers out there that do some really good presentations with that too. Mutual of
Yep.
Omaha's got a great piece. So some different things that we'll make available to folks, but we'll go through and get that done as well. Some of the things that we have, of course, is translation of language. A lot of times, different segments of our society, we have our own acronyms. We have our own, well, we need to do this ASAP, MOUSE type of thing. What does that mean? So one of the things that will come out is a link to this guide put out by the Medicare Learning Network, a government website that translates some of those acronyms. Todd, we've been in this clear back to last century. And it's amazing how different acronyms will still pop up and you go, ooh, I haven't seen that one before. And boy, you
Right.
think I should know about that. But there's always something new. So this isn't meant as a, oh my goodness, you're totally ignorant. It's meant as a fallback, helping someone visit and communicate and properly communicate. We find ourselves using acronyms and we really need to get away from some of that.
I would agree. I mean, a lot of the financial advisors recognize they want to begin to offer Medicare, but they're new to it. So you have to understand, and I'm not meaning this negatively, but their level of understanding. And all of a sudden, you just start whipping out a bunch of AEPs, SEPs, ICEPs, and they're going to look at you and say, forget it, I'm done. I don't need to deal with this. And yeah, you need to basically understand that there is a big learning curve. So just throwing acronyms out there. Yeah, and you and I, John, are not smart enough to understand all those acronyms anyway.
No, we need a translation guide too. And I think that's one of the nice things that give us an opportunity when you look at this as to what other resources are available to help approach this market. We have a ton of Medicare 101 presentations that can be very helpful. We've got some presentations of Medicare Advantage versus Medicare Supplement. So a number of things that we'll show in a little bit as to, well, you don't have to know everything because no one does. And the point is, how do you access the information that's necessary to make that explanation? And I think your organization and ours does a pretty good job of delivering on that educational material. So all part of speaking the language and communicating properly. And we really need to do so because surveys that are coming out, it's really kind of scary how many people don't look at their coverage year to year. And Kaiser Family Foundation tells us that 70% of the population don't. And it doesn't matter what their options are, if it's overall, if it's in the Medicare Advantage space or in traditional Medicare. And Todd, we go back so far as to product that didn't have prescription coverage in it. Remember when the old Pacific Air would roll out $600 worth of benefit for a year in the old days? You know, and comparing those coverages year over year when it comes to the medications, that's paramount to keeping someone's finances in order. So a mindset there. And it particularly affects some of the particularly vulnerable populations. So if you have that in a target market, we need to be aware of it because everybody gets that Medicare and You book in October, either mailed or sent to them electronically. Folks aren't cracking it. I mean, they certainly, a big portion, aren't using some of the apps that are available put out there by government as to what is carried, because this will demonstrate, once again, a slide from Kaiser. This is why I feel it's so important for any segment of the insurance world that's dealing with this population of being aware of what is covered and what is not and how to broach this conversation. So to a point, Todd, this is year-round activity based on what they haven't done in the past as well. And I think that fits kind of a scheduling of a professional as well. We also need to make certain that we're able to deliver this information in the fashion that the people can actually access it and comprehend it. So being able to do face-to-face presentations, Todd, you mentioned some of the seminars that financial advisors do and the PowerPoints and the different presentations we have in play there. How have you seen some of your folks transition over this term of the pandemic from an in-person to a virtual presentation? Are you seeing percentages that are doing that? How is that working for the financial professional?
Great question. So, as I mentioned, a high majority of our financial professionals, they were doing seminars. And when COVID hit, basically a number of them had to pivot. Now, I will tell you one thing too. One of the conversations I had with one of our financial professionals, they said they were so thankful that they got into the Medicare space because of the reoccurring revenue, because it was paying some of the bills, paying some of the rent. They had that opportunity because the seminars were shut down, and they had to refocus, or I should say pivot, into webinars. And you know, here at Advisors XL, we have a number of resources, and we help a number of our financial advisors start to do webinars to their current clients. And there was a lot of evergreen type of webinars where it would just continue to play. You didn't have to do them. I mean, you recorded it from a live standpoint, but it basically, you could just play it, and you could do it throughout the day. And a lot of professionals found that to be a great opportunity to get more clients and touch more clients, because they just couldn't do it during the seminar. So we are seeing a number of advisors embracing technology, and not to say that the in-person seminars is going away, but you've got to be able to adapt in this changing world, and a lot of the advisors have. So
That's awesome. And I think it's important then to work with an organization that actually can help with technology education, providing some of those programs as well. And I really appreciate the fact that you guys do such a good job with that as well. And it's one of the things that we make a big point of it because, well, we're training people to do that. Over the last year and a half, 2 years now, you have delivery of all sorts of services being handled virtually. And the population that we deal with, for the most part, in the Medicare world, have become increasingly digitally savvy because, well, hey, that's the way they went to the doctor. That's the way they went to the specialist. You saw prep work done with hospitals and dentists in that area. And to this day, well, here in my portion of Texas, we have some school districts once again going remote, virtual, and you see different other aspects of life being handled that way. And I don't mean to be so philosophical about it, but hey, there's a whole bunch of religious celebrations or services that are handled virtually as well and never have changed. So we train people in order to deliver that information to them, and them being receptive and handling it. It's a little bit different world where sometimes people will go, oh, it's the internet. Seniors aren't doing that. Well, not
yeah, they
so.
are.
Yeah. This, I think, is a really cool point too, and pertinent to our conversation, is the fact that as we get into Medicare, using that as either a means that we'll talk about for prospecting and other things, but it's also another product in the household that helps with persistency and retention. And I remember back in the old days with Prudential, where we would have two different standards there for the products that were sold in the first couple of years, the persistency, retention there, and then long-term persistency. And this tells us that, well, the more product you have in the household as an agent, the better your persistency across the board is. You have someone that's not a policyholder, they're a client. It drives up that across all boards. And then studies show it doesn't have to be with the same company, it just has to be with the same agent. So as you mentioned, Todd, when you have different people within an office handling different aspects of it, or someone doing it on their own, it really creates that identity and drives up that persistency and helps with selling other product. And I think that's the point I was trying to make with this is, gee, there are different things we'll talk about here that Medicare doesn't cover that we really need to address. And this can really drive up the persistency in life product or investments and other things too as well.
Yep, exactly.
This is another piece too that might be helpful for a lot of folks, that particularly in this time period where, what is it? Yesterday was a deadline for 1/1 effectives for people that are on the healthcare market, the health insurance marketplace. And knowing the difference between those programs and how they interact with Medicare can be of great importance. We've got some different pieces that can help there too. But when you're talking about a transition of an individual who's working to not working or changing base coverages, that I think is a great opportunity as well. And I would imagine, Todd, that you see some folks that run into this frequently.
Definitely. And now look, John, I'll be honest with you. We are an organization that works with over 65, the under 65 market. We have avenues, we've got partners, we've got different individuals that we rely on to get that guidance. But as somebody is transitioning from their working years, considering getting into approaching Medicare eligibility and signing up for Medicare, yeah, there's a conversation you need to have with them. And we try to provide sources and avenues for our advisors, so if they've got these type of questions, plus the Medicare side as well. But yeah.
I think this will tie into the topic that we discussed a little earlier that Christopher suggested, is to, when's the best time to take your Social Security? Well,
Yep.
kind of an adjunct presentation is, how do you make certain that you have your base medical with Medicare in play as you come off of work as well? So that might be a topic we explore in the future too, Todd.
Yeah, and real quick, I was just going to mention, one of the things that we get a lot of questions on, and just because you were talking about the dental or ancillary, there's a number of people that basically are working and they have, pretty decent dental coverage, and then all of a sudden they get onto Medicare, and for whatever reason, they think Medicare is going to cover dental. And we educate our financial advisors that Medicare does not cover your routine dental coverage, and that is something you definitely need to look into. So anyway, it was just,
Yep.
yeah.
I think that is actually a very nice segue into some of the future slides we have here as to what Medicare doesn't cover. And I think that'll be something we run through. We hear a lot about the different election periods. One of the things I wanted to lay this out here for is the fact that, okay, the standard election period, sometimes we'll think that, okay, as of Pearl Harbor Day, open enrollment's done, we're not going to work with any Medicare people throughout the rest of the year. And what is freaky is there are so many special election periods that the majority of people that are on Medicare can change throughout the year, for one reason or another. And as we run across the folks that really need to take advantage of some of these, as I lovingly refer to as a get out of jail free card, it makes a difference because you can work throughout the year, and you have different SEPs that come about because of weather and other activities too. But it leads us then into, when we get into the Medicare space, what are some of the differences between the selling opportunities on the base coverages that we have? We talked about a little bit about doing a future presentation as to making certain we have the underlying A and B there, but that goes back to, Todd, a little bit of our discussion as to what's the proper product for the individuals we visit with, and making assumptions as to, well, gee, I'm only going to work with people on Medicare supplements. And I think you reinforce the fact that, hey, that's not necessarily the case, even in organizations that do a lot of financial advice. Thoughts?
No. Here's what we do at our firm or here at Advisors Excel. I stress to my team, I stress to anybody who will listen to us, we're not salespeople, we're educators. And the truth of the matter is as somebody is approaching that Medicare eligibility, if you not only are taking care of their wealth care, you're going to begin to take care of their health care. And if that individual has entrusted you with moving financial assets over to you, they're going to listen to you regarding what type of guidance would you suggest. And what we do is we try to walk our advisors through basically an education that they will provide to their clients and talk about what are the differences of a Medicare Advantage, what are the differences of a Medicare supplement, and not just assume, well, I'm looking at this client, they handed me, $750,000 of assets and they have enough money to basically do a supplement. No, sit down, talk to them about the differences, because that's really what it is educating them about the differences, because a lot of times people just don't know. So again, you would have thought, you're going to sell as a financial advisor way more Medicare supplements. I'm not saying a Medicare supplement is not as good as a Medicare Advantage or vice versa. But what you're doing is you're explaining the options to them, and then that client usually knows what decision they're going to make after you've educated them. So yeah, that's what we try to do.
Awesome. And I really appreciate the fact that our organizations do a really good job of helping people get licensed properly, depending upon the state, do the contracting process and the certification, and realize the differences between those choices. Because personally, I feel that not only offering all the products that are available gives us a greater opportunity of finding a great solution for our prospects and clients, but it also makes certain that we are doing, as you mentioned, education. So
Yep.
here are your options. I have my ideas based on your situation as to what the best option may be. But going back to our past, the things that we saw on television with "it's free" or "are you getting everything you're entitled to," making certain that we have the knowledge to respond to Joe Namath, Joe Theismann, Joe Montana, Joe Schmo on the street, Joe Plumber. We'll bring it back an old guy here. But I think that's one of the things that we need to make certain that we realize that how we approach ourselves and the differences that brings to us in the marketing opportunities. We'll talk about that in a second, because one size doesn't fit all. When we look at the Medicare and You book, it gives us great detail as to what is covered and what is not. The Medicare Bible. I think, Todd, you and I may be in the 3% that have actually read this document in its
Yeah.
entirety at one point in time. It is a great substitute for Sominex in certain areas, but it's a great reference piece that a lot of people use in their presentations. And it gives us then that talking points that we talk about as to why do we need coverages in addition to Medicare, which is a question that needs to be covered because of the deductibles and coinsurance on the base care for both A and B. But it then gives us additional detail as to third-party influencers as to here's some additional information on your options, all
Yep.
available by the government, different tools that can help you quote the different things as well, details on Medicare Advantage plans. But I'm flying through a bunch of this simply because a lot of folks will assume, to your point earlier, Todd, that as people go on Medicare, the prescription coverage comes automatically as well. And when we don't play that, like they used to say in Living Color a long time ago. So having
No.
having the detail on how to deliver this is a big deal. And this is where you see a lot of the variance year to year on cost too. One of
Yep.
the reasons why we need to do an annual review. And I think that does a couple of things for an agency because it keeps them in front of them, so you have a better uh, need, in a manner of speaking, to communicate on a regular basis. But also that annual review speaks to other possibilities. Now with MA and PDP programs and the scope of appointment that they need to do, it may necessitate a second presentation, but this really opens up that fact finding. That is a big part of it. And one of the things that I've seen from what your organization delivers, Todd, is help in that area. How do you talk about different products and stuff? So
Yep.
I appreciate that with that. You mentioned the dental, and this is interesting because people may have grown accustomed to dental coverage at work. The general consensus in my mind is dental coverage is not nearly as comprehensive as some of the other pieces. I was trying to be politically correct there. But to your point, Todd, this is one of the things that you really can help people with as they transition through different phases of their life with an ancillary product that sometimes people will think, man, I'm not going to make any money on that. But if you have a couple in a household and you give a good, solid dental program, you can make as much on dental products as you can on some of the base medical. And that's a
I will
big
tell
deal.
you this, John. One of the things too that I mentioned a lot of sub-advisors who will be doing this. You know, the financial advisor usually, in a lot of cases, what they'll do is they'll pay them a salary, and then what they do is they want them to work with those clients, and for the most part, just selling a Medicare supplement or a Medicare Advantage, it's a good piece to help that client. But from a revenue standpoint, they also want to make sure that they're covering some of the things that the clients are not aware are not covered, i.e. dental. So we train them to make sure that they're asking the questions. And one of the things the carriers have made it easy is, for instance, you're selling Aetna, all of a sudden you sell a nice MedSup, boom, here pops up a box and it says, you think your client would like this dental plan and here's what it is. So they make it a lot more easier than in the past when you had to transition. It's an opportunity for that sub advisor just to continue the conversation. And then also get into some of the other things, for instance, a cancer plan, or just touching on some of those things as well. But you mentioned two things I just want to touch on real quick, and that is, as I'm sitting here and I'm looking at that Medicare and You guidebook, one of the things, John, in the past, some of the agencies that maybe were working with financial advisors, they'd hand that big booklet to them, say, read it, and nothing. You have, as an agency, you have to invest the time. If you're bringing somebody on, if I look at this slide right here, John, there's words on there. They're learning too. You have to be able to have what we train a lot of our Medicare VPs. What they do is they'll do webinars, one-on-one, just quick webinars, just to walk through them. So you're having that conversation. We also do on-site trainings as well, those kind of things. But that's one thing that I think Premier Advisors Excel, we do a good job of making sure that they're educated, because they're going to have to go out and talk to their clients about this as well. And just reading it doesn't do it. So.
Yeah, a couple of neat points too is the marketing aspect of this. Many of the companies that offer dental programs will create a microsite that's available and exclusive to an agent. So another way of exposing yourself to the population. That did not come out correctly. But it's also a way where a lot of folks were seeing, since you can't cold call for MA or PDP programs, you can for Med Sup. Some folks are more apt to offer a demand product like dental, particularly when many of these see a price increase at 65. So a great way to add to your T65 funnel of product as well. So this is an area that is, in my past, I've sold a long-term care policy or two, but it was more like hunting whales or elephants, a great underserved portion of the population. But this is an area that's of great confusion to many people, because they come on Medicare and they think long-term care is going to be covered as well. And having some of the detail available on how you address this situation, be it a long-term care situation, or work through not only how people handle assisted living moving forward, some of the things that come about with skilled nursing care, it is a piece that can make a big difference for folks and is a key part of a financial plan, I would imagine, moving forward. I know my long-term care policy has really jumped in premium over the last year or so, but it's a key component that's underserved. And I think that's a great way for an agency to differentiate themselves as well. Todd, that probably would be another person in an office or someone. How do you come about with some of the familiarity of what is necessary in this area? What do you think?
Well, yeah, so what we see most sold, if you will, are the hybrid plans. So if you think back to the old traditional long-term care, you choose a $100 daily benefit. There's a deductible involved. But what we see now is a transition of assets. So basically a product that you would move into a life chassis, but have long-term care benefits. There are some annuity chassis, and it provides long-term care benefits as well. But that's what we're seeing more being sold. And to your point, John, the Medicare sub-advisor, they are in a lot of the offices. They also are that trained person to start that conversation with the long-term care. Now, I think the financial advisor, besides really focusing on life insurance and long-term care, that was something that they focused on. So they have a knowledge base, if you will, for these particular products. But also, I think a sub-advisor, my opinion is, I don't think you necessarily need to have a specialist just long-term care. This Medicare person could do it as well.
And I think people, as you said, if they're familiar with some of the life products that are more of a hybrid beast now, this is a comfortable part of the conversation as well. Great reference point, though, as to why you need it, because Medicare is not going to cover. We talk also about a lot of the base life insurance products. A lot of people will assume, well, gee, they're going to bury me as well. That lovely $255 lump sum benefit, if you qualify for it, doesn't really even open a gravesite anymore. So it leads to a lot of the life discussions beyond final expense. So have you seen, Todd, some of the financial advisors make certain they have final expense policies that are available, or is this part of a portfolio that some of the folks you deal with have, or how do they deal with this portion of it?
great question. So the financial advisors who, let's say, came from a captive background. I'll tell you one company in particular because this is the one that I run into, bankers. A lot of financial advisors cut their teeth in the bankers world. So they were well versed on Medicare, they were well versed on long-term care, and also final expense. I will be candid with you, John. The final expense product per se is not a big seller for us. Could be for some other organizations, but we don't see that as a prolific type of policy being sold in our organization. Should it be talked about? Sure, but we just don't.
Well, the cost per thousand on life insurance on some of the smaller policies may not best serve everyone in their situation. And I think the advantage your folks have in discussing the different programs, they can differentiate between the types. And this discussion may not bring about a final expense program. It may talk about greater amounts of life insurance and other estate planning pieces. So a part of a conversation. One of the things we want to talk about very quickly here, because we're coming close to the top of the hour, is some of the different programs that can make you comfortable as a financial advisor offering some of these programs. So these are a ton of these are available. Todd's got some great presentations in this area. We do a lot in this area as well. But being familiar not only with products, but concepts and the technology that's necessary to come about and bring these people into your book of business as easily to follow in Todd's mentioning earlier of how can we make this as simple of a process as possible. Knowing about it is, I think, it's the biggest first step. And Medicare helps us with different trainings. It reminds us we don't want to put all our eggs in one basket. I love that little meme there. I don't know, it's just weird. And remembering that one size doesn't fit all, but using a comprehensive plan to reach out to the population. This, I think, is one of the things we really need to stress in today's presentation very quickly, is the fact that one of the reasons a lot of folks will look at the Medicare market is it brings in a different demographic, but also different ways to approach the population and be in these different areas that you can bring about people that want to talk to you, actually speak to you and deliver that information. So we want to make certain that folks that come into Medicare are aware of the compliance requirements, and that's part of the licensing and certification process, but how we can use these to visit with the folks we're already talking to. Todd, you mentioned that many advisors will use the seminars, and many of them have transitioned in the webinar presentation as well. Having that available and having different topics that you can roll through, concentrate on a particular target market can be a big help to people. And we have those different things that can help in that area too. But we get into some of the things past the, the carrier programs. Sometimes the companies will toss us a bone, so to speak, when it comes to leads and things. But some of the other things that come into play here that are self-directed and can be more immediate in detail. And that includes, cold calling, the different pieces that are there. Todd, do you think a lot of financial advisors utilize that relationship with Ma Bell, or how do they go about bringing people into their organizations?
No, at least in my experience, the cold calling aspect of it is not. What we have found with most of the financial advisors is a three-pronged approach. If they have been doing the seminars, we have numerous seminars. We provide the PowerPoint, we provide the talking points, we provide the mailers. We've got partner vendors who work with us and can help those financial advisors get into, a college, what am I trying to say, room. So you're not having to spend money, libraries, different venues where you have the ability to deliver that information at a very cost-effective from an outlay, if you will, from the financial advisor approach. So you can do it that way. We also work with we have our own quote unquote partner digital marketing. Now, this is something new for a lot of financial advisors, but quite frankly, new for a lot of other agents. And digital marketing is not the cheapest, I will tell you, and it is a long-term play. But used effectively and with the right partner, it can have dividends. for you. And a lot of people, as we talked about, John, Mr. and Mrs. Smith, they're on Facebook, they're on different things looking at their grandchildren. So that's an opportunity. And quite frankly, then the last one, John, is we do have some old school who just use business reply cards. And those are the three-pronged approach. But again, I always tell the financial advisors when they start, go to your current client base. We have all the tools to make sure that your clients are aware that, hey, John now is offering Medicare, and I want to be that guidance to help you. So,
yeah, constant communication in one fashion or another.
Yep.
We do see, well, pick up your own smartphone. How many robocalls have you already gotten this morning? So we're seeing some difference there too, where I'm at the point in time where if it comes in as a toll-free number and I don't recognize it, I don't pick it up.
Yep.
And that's so we see some stressors when it comes to this area as well. We talked about some of the community presentations. Working with providers, I think, is a great area for a lot of people because it not only includes the referrals and the work through the practice, but it gives us access to that provider as well. So doctors and dentists, some of the folks that may be a little higher compensated than some of the other individuals in the world, but a great way for us to reach out to them. And there's a number of categories there that we can work with. We talked a little bit about the generating that piece, but you mentioned, Todd, the social media aspect of it, and it's a great demonstration in my mind of the microwave society we live in. Instant results. One of the things that we've seen is folks that work this area need to be really cognizant of the fact they need to reply quickly as well.
Real quick, so I'll tell you a quick story. So we piloted when we first started, and some of the financial advisors, again, this was new to them. So we basically worked with a few financial advisors who said, yeah, I want to get into this internet or social media. They get the lead to come back in, and then all of a sudden they sit there and say, you know what, I'll call them here in whatever, a couple hours or whatever the case is. What we have found, if you do not contact that client at least 7 times within the first 12 hours, it's not going to work. But so many people think, well, I don't want to bother them. I don't want to do this. Well, we coach our advisors on how to communicate with them, how to talk to them. You're not bothering them. They reached out. You're trying to help them, educate them. And I think when clients begin to realize, hey, this isn't a scam, because that's one thing that a lot of seniors, they respond and they are going to be a little hesitant. And the way you approach it, getting back in contact with them in a quick, professional time way or frame pays off. So
great. And that's the thing. A lot of times in some of the Medicare chat rooms that we see on Facebook, they talk about how many times do you reach out to an individual once they respond. You mentioned the rule of 7 in a manner of speaking there. A great way of reinforcing to us that we need to honor the request. And as you mentioned, that means doing it quickly.
Yep.
Much as were today's presentations being recorded, we have past presentations that are available to you on our website or on our YouTube channel that speaks not only about concepts, but particulars about carriers and other things of that nature that are available to you 24/7. You don't have to register to see them. They're there for you for your use. This is a great tool that we offer that is an electronic means of reaching out to the population. And I think some of the folks that when they get into Medicare, the compliance aspect of it and adhering to some of those parameters is of utmost importance for them to adjust some of their style. So that scope of appointment needs to be stored for 10 years if you sell them or not. That gives us a great opportunity to go back and cross sell as well, though, if you sold or not. So having this technology is great. Carriers are delivering on a bunch of different things, as Todd mentioned as well, where you complete an application for one thing, you can click on another product and it fills a whole bunch of that automatically. Great piece of electronic means, great way of comparing tools and keeping people in the house. Different lead programs are available. Todd's organization does a great deal with support as well. We do some things with direct mail. And I think one of the things that we see in all these different pieces of approach is consistency is a key. It's like exercising once and thinking that you're going to be buff. You feel the pain, you don't see some of the advantages of it. So doing it consistently is a big deal, be it direct mail campaigns or purchasing responses, different pieces that are available off the internet. One of the things we do offer is a T65 locator tool, which is really cool. But for folks that aren't out there knocking doors, aren't final expense agents, or deal a lot with med subs, this is a tool directed at some specific organizations, I think, in that area too. So I think one of the things too that we'll talk about in kind of a closing, Todd, is the whole, what's a referral? You mentioned a lot of the advisors, your recommendation is going back to your book. And one of the things many of us forget to do is when we talk to people, particularly someone that's done business with us in the past, or at least has been exposed to us, is their willingness to tell us about other people sometimes. And the referral piece is crucial through the sales process. But as you go back and visit with your client base, asking them for help, asking them to know of, have anyone else that you can help. And I think in your space, particularly since we kind of hang out with people that are like us, we're going to see a pretty good lead source come out of it if we just remember to ask. I pulled the slide, Todd, in deference to the not politically correct piece, because I usually throw in Pepe Le Pew and Penelope here where he's trying to get a kiss. But it's one of those things where you don't know unless you ask.
Yep.
That's a big
it is, John. Now, one of the things that I will tell you, a lot of the financial advisors, at least in our experience, is it's a way how you ask. And what I mean by that is you're not sounding desperate because you're helping this client, but there are certain ways to ask for that referral where, I guess in a nutshell, John, it's sometimes if you seem desperate, which they're not, but it's how you approach it. And that's what we teach our advisors on, how you ask that question and what are some of the follow-up steps similar, I know that you guys do. So
yeah, we've actually got a presentation recorded as to how to work referrals into your sales process and your follow-up process as well.
Yep.
And I think your point, it's not being who else do you know? I know in the old days back in Pacific here, we in North Texas purchased a health plan called the Harris Health Plan, and the folks that came over from there had some interesting referral techniques where pre-electronic, a lot of this is, okay, you got your address book, bring that out, put my name in there, so I'm there for you and you have contact information about me. And by the way, since you have that out, who's in there that I might be able to help? Really a blunt approach, but there's some interesting ways of getting referrals without being really Herb Tarlick about it. So
there you go.
It's all a situation that basically we want to help people help people. That's a shared aim of our organizations. And I think that getting additional information about these different categories is crucial to our success. Having an additional revenue stream into an agency, another way to market, all the different things that come into play. It's our opportunity at this time, Todd, to say, hey, we want to help you. So we need to ask you as a financial advisor, as an agency that hasn't been active in this market, to investigate it and put it in play. Sure. Folks realize as they speak to me a lot of times that I'm a big John Wayne fan, and I love the movie The Cowboys. And he has a line in there where it's the slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. This is a program that you can implement really quickly and put it in play where you don't have to worry about, oh my goodness, I got to wait till October 15th. No, it's a year-round activity. And I think that's really helpful for an organization that's taking this elephant a bite at a time. And to your point earlier, Todd, being comfortable with the products and the approach piece of it. So I urge people to use that mindset.
John, last point that I'm just going to make is, and we hear this with a lot of our folks that we're working with, if they look at it and say to themselves, you know what, to me, it's not something I want to do. Well, if you don't help that client, somebody else is going to. And if you want to have that client have the opportunity to talk to somebody else and that door opens, it's just, we have the opportunity. Now, I will tell you this, if Medicare is something that you decide, you know what, just at the time, the bandwidth, my resources, I can't do it, partner with somebody that you know that will help your clients. We now have opportunities with call centers that we are working with some of our advisors who We have a vetted call center. They're taking care of the Medicare piece. The financial advisor is taking care of the financial piece of it as well. But my point to everybody is, don't let him go down the street. Try to help it out. So
it's an adaptation of Zig Ziglar, closing the doors behind you, so you can help people. I remember Prudential at one point in time got into property and casualty because they wanted to enter a household through the largest door, through the garage. Sell car insurance. I think it's a little easier if you partner with a property and casualty agent, but looking at the different opportunities there, you don't have to be an expert, I think, is one of the things that many people will fear, because you have resources to go back and ask questions. But shutting the doors behind you to make certain that your book stays with you, creating an additional revenue stream, giving you additional marketing opportunities. That's why we're talking today. So
that's
we
right.
can help agents in that area. So all that said and done, most folks know how to contact us here at Premier through our toll-free number or through our website. I want to make certain that you realize you'll have information from Todd as well on some of the services that they offer and the opportunities that are there. But we're at the top of the hour. I want to thank Todd for coming on and visiting with us. Thank you, Todd.
Thank you, John.
But at this point in time, I want to thank you as the participant in this presentation for your time. It's your most valuable asset. And I think with the tools and the products that are out there, we can coordinate that and give you the maximum value, the return on your investment of your time, and make it work for you. For those of you that have done business with us in the past, we thank you for that business. For those of you that are about to, we thank you for that. But in the meantime, until we're able to visit again, and watch for some different pieces that'll come out a little shorter than today's presentation, that Todd and I will discuss some of the subtopics that we touched upon today. Until we're able to speak with you again, hey, we're wishing you good selling. Happy holidays, Merry Christmas, Mazel Tov, all the other things that we need to speak to at this time. Thank you. Really appreciate it. Once again, Todd, thank you as well. And for everyone else, we wish you good selling, and we'll talk to you in the near future. Thanks.
Thank you.